Howard Dean was at a healthcare town hall in Reston, Virginia, with Representative James Moran. It was a vibrant and exciting show of democracy in action, and Representative Moran went through the many myths that have been spread around healthcare reform.
The legislation includes a very important provision. And, of course, it's energized people across the political spectrum. It's a provision that doesn't seem to be fully understood, but could do the most to bring down long-term medical costs and to adequately insure every American. And that provision, of course, is the so-called public option. Energize people. I guess that was a fair term. Perhaps a little understated. What the public option means is that the federal government would provide Americans a choice to purchase a government health plan like Medicare that would provide a basic level of insurance. But no one would be required to join the public option. Everyone is still free to purchase private insurance. Now, the private insurance companies, we think, are going to want to be more competitive, and so private insurance premiums will probably go down, hopefully, not going to be a Cadillac insurance plan, but it's not going to have a whole lot of frills on it, but it will focus on providing access to quality preventative care using the physician of your choice. The cost of the bill will be roughly $100 billion per year for the next 10 years. But that cost is going to be fully paid. From a graduated surcharge of 1% that starts with each dollar over $250,000, and in the case of individuals, and each dollar over $350,000 in the case of families. It applies to the wealthiest 1.2% of Americans in the United States. So in other words, it does not affect 98.8% of wage earners in this country. It's estimated that this will raise about $544 billion. Over 10 years, in other words, approximately $50 billion a year. The other half, the other $50 billion, would come from reforms to the healthcare system, including the Medicare payment system. Medicare Advantage reimbursements to providers, and a program to dramatically reduce hospital readmission rates. What is designed, what is envisioned, is that if a hospital does the right thing initially so that people don't have to come back to the hospital consistently, they get additional reimbursement. Now, hospitals where people get infected in the hospital, or where it's found that the care was not adequate and they have to keep returning, hospitals with high readmission rates will be, relatively speaking, pay a price for that in terms of reduced reimbursement. That's the kind of incentive we're building in so that hospitals reduce the amount of infection, which in fact is one of the major reasons why people have more serious illnesses. We have a high rate of fatalities in hospitals. So what we're trying to do is to give incentives for hospitals to do it right the first time, and also to be as clean and sanitary and professional as possible. Now let me say, in Northern Virginia, we don't have that problem. But that is not the case throughout the country. And I know you care about our friends throughout the rest of the country, not just for ourselves. Now, the reason why we are doing this is because of a lot of things that occurred that have put us deeply in debt, such as the Iraq War, which was never paid for. Not increasing the national debt and not passing the debt on to our children. President Obama, what I felt was referenced in Rabbi Nosson Chuck's publication, believes this very strongly. And the Congress is committed to this principle as well.